Hi everybody, this is your little fix-it video, self-healing video for scars. And when I'm talking about scars, I'm not just talking about surgical scars, I'm talking about emotional scars, I'm talking about fractures, I'm going to talk about any major issue that gets stuck in your tissue. But let's talk about surgical scars first. So what I've done is I've put a little piece of tape here because all my surgical scars are in places that I don't know if I want to show you. I've got a very large scar right here from my resection when I had cancer. I have very nasty 2 C-section scars that are, one was done up north and yeah, it was actually performed by a GP. God love him. I'm alive today and my son Matthew's alive today because of it, but the scar tissue, pretty nasty. I also have one on my back. I have, where else? Gallbladder scar. Anyway, a bunch. Anyway, so this is going to represent an imaginary scar on my arm. And so I want to show you first, nice and close here, how you can help normalize the scar. How do you know a scar is giving you grief? One way is you can take your fingernail and you can just scratch across the top of the scar. And if it feels like, I just pricked myself with a pen, I made a big face, but it really doesn't hurt that much. But you do go, oh, I noticed that. That's one way. You can also tell because you're going to feel pain elsewhere. You're going to feel referred pain. So always check the scar first. In osteopathic school, it's one of the first things we were taught. Get those scars normalized. Get them moving with the tissue. When I say normalized, and sadly, once you have a scar, it's there for the rest of your life. Yes, it is. So surgery should always be your last resort. Last resort. So if you have to, you have to. I get that. However, if it's a choice, maybe choose something different because now you've got that scar to deal with the rest of your life. And it's not just what's on the surface, it's deeper in the tissues. Consider my C-section scar. That goes through 9 layers of tissue to get to the uterus, to get the baby out, 9 layers have been affected, all right? Same with the appendix. Goes through a lot of layers to get down to that appendix. So back to the scar. So you're going to take your fingers and you're going to just connect to the scar. I hope you can see this. There we go. And you're going to push up, down, and see which way it likes to go. Okay, doesn't like to go, I don't have a scar here, but my fascia is a little tight because this is the wrist I broke. So I like to go up. I like to go down more than I like to go up. So little resistance, I'm going to go down. Okay, now go side to side, left, right. Which does it like to go? Okay, she likes this way, which is left in mirror image. So I'm just going to go this way. This way is a little more restricted. Then I'm going to rotate and rotate. So that's a little restricted. This likes the more. Okay, so I'm going to stack those. It liked down, it liked this way, and it liked this way. So I'm going to hold it and hold it and hold it while it unwinds. It's like the telephone cord that was all wrapped up and tangled is now being unwound. There it goes. And then see my hand moving? I'm not moving my hand. My tissue is moving my hand. And then you can retest it. And then you can go up and do the other. Let's check this. So I go, this likes to go up. That's interesting. Likes to go up more than down. Likes to go the other way. That's really fascinating, isn't it? Yes, it is. Rotate, rotate. Likes to rotate the same way. So I hold it. I'm actually feeling that in my hand. This hand is very tight from that fracture. There it goes, and it releases. All right, and then you can retest. So anywhere you have a scar, I mean, I have one on my back that I can reach over and grab. I can do the ones, my C-section, my appendix. I can do my resection one. If you've got one way in the middle of your shoulder blades, you're probably going to need some help doing that one. All righty, so let's get down on the floor for you ladies who have had hysterectomies or C-sections or appendix out or hernias. Oh, now we have a foreign object in the body that we have to deal with too. So we're going to get down on the floor and I'm going to show you a global way to help release, Yeah, release the scar tissue, normalize the scar tissue, get the scar tissue working in a much better method that it works with the body rather than against the body. Because once that scar tissue gets, fascia and scar tissue don't like each other. And once it get all tangled up, then the nerves and the arteries and the veins that travel through that fascia get inhibited, get impeded. They're not happy. And if you've got an artery that's not being able to fully feed your tissues, those tissues aren't going to be happy and you're going to feel pain. Same with a nerve that might be infringed on. It's going to feel not so happy and it's going to give you pain. All right, let's go down to the floor. I'm going to take this off so it doesn't distract you. And we are going to talk about tape. That's rock tape. And I'm going to talk about that when I talk about fractures and other things. So let's get down on the floor. And so this is for our folks with C-sections, hernias, appendix, resections, any abdominal surgery. And I will do one for the lungs as well. Should have did that before I sat down, but that's okay. We'll get back up. I have to get back up anyway, turn the camera off. So, get yourself comfortable, your knees are bent. That's going to take the pressure off the abdomen, all right? So, you can go to one particular side. If you have, say, a hernia on the right side or the left side, you can go to that particular side and do the same technique. You can also work along the scar itself, just like I showed you. So I'm on my appendix scar, and it's a pretty nasty one because they ended up taking part of my cecum too. Well, it's interesting. So anyway, I'm going to go left, right. And actually when I go right, I feel a little burning. So that's telling me also the scar needs to be worked. So I'm going, where does it like to go? Likes right better than left. Up, down. I think it likes up better. Rotate. Definitely likes this way to rotate better. So I'm going to hold that. I can feel things starting to shift in my tissues. And there I go. Nice. And you would do that again and again and again until it didn't have that burny feel again. I could do the same thing with my C-section scar down here. Up, down, side to side, rotate, wait. You could also go into the correction, or what's called a direct technique. You can go into where, before I said where it likes to go, you can go into where it doesn't like to go as well. So you can do both, but I would suggest you go where it likes to go first. And then if you feel like you want to do a little bit more, go to the direct correction. Go to where it doesn't like to go. Now, let's and same with the hernia. If you had a hernia scar, do the same thing. Up, down, all around. Up, down, side to side. Rotate. Where does it like to go? Wait. You'll know that it's responding. You might be able to feel it, but if you can't, it's difficult for everybody to feel that. I get that. You might take a spontaneous breath. You might feel softening in your tissues. You might not feel any of that, but just know that it's working. Now, for those of you that have had hysterectomies, and it's been done vaginally, and another time, a lot of people go, well, it's just this little scar on my belly button. And same thing, those little scars isn't just what's on top, that's gone down deep. I've got a little bit of a scar here on my belly button where they did the laparoscopic work for my gallbladder. So, and I can feel that needs work too. I obviously need to do a little bit more scar work on myself. Now, let's go back to the ones that have had vaginal hysterectomies. You're going to grab on to your skin here. All right, I know it's not pretty, it's okay. It's all right, it's just excess skin. And try to sink down in your mind's eye, sink down to the layer of the hysterectomy scar. And think back, just really sink down to that layer. Now, lift up, push down. Which does it like to go? Lift up, push down. Mine likes to go up. I don't have a hysterectomy, but I've had 2 C-sections and a resection. So there's a lot of scar tissue there. Now I'm going to go right, left. It likes left better than right. I'm not using mirror image here. And now rotate. Oh, it definitely likes to rotate better this way, so I'm going to hold it. and hold it, and I can feel quite a nice release going down my left leg, and that's probably giving my sciatic a nice little release. Ah, feels amazing. There we go. I remember back to this patient I had when I first was starting, way back. Now I'm just going to go for a different area and do the same thing, just a little different area. You find a different area. And he came to me with quite bad sciatic pain. And I was just a new osteopath. Actually, I was just still in school, yeah. And had been taught a lot. We've been taught a bit. But of course, scars are the first things that we're taught. So he had an appendix scar. And I'm just finding it liked up better, it liked to the left better, or to the right better, rotate, and I'm holding it. So I worked on that appendix scar just like I'm doing with you guys now. And he got up off the table, he said, "I don't have any pain at all." He left, and I never heard from him again. And I thought, uh-oh, he thinks I'm a quack. He was in for this terrible sciatic pain, and all I did was work on his appendix scar. I did some other things too, but mostly that. And so, quite a few months later, I ran into a friend of his, and I said, who actually had referred. I'm going to a different area now. Up, down, legs up, right, left, legs left, rotate, rotate. I got my rotation. And I ran into her and I said, what happened to so-and-so? He never came back, and is he okay? She said, "He's fantastic. He thinks you're amazing." It's not me. I'm just guiding your tissues. He said, one treatment and it cured it. So anyway, that doesn't always happen that way, but I always found that was quite fascinating. Oh, this is releasing nice. There we go. All right, and you can do that again and again and again and again and again. Now, let's say you have a scar in your breast from breast surgery, lumpectomy, or a mastectomy, or you've had lung surgery, or you've had heart surgery, whatever. If you have an external scar that you can find, that you can feel, same thing. Up, down, right, left, rotate, rotate. And hold it until it unwinds. All right? Or you can take your chest as a whole, after you've done the individual scars, you can take your whole chest as a whole. All right? So grab onto the tissues. You might be grabbing some boobs there. That's okay. So, up, down, right, left. Likes right better. Up, likes down better. Rotate, rotate. So it likes to rotate this. So I haven't had any surgeries except gallbladder surgery here. But what I have had happen is I fractured my left arm. And it was a bad fracture. And I've always felt it on my left side for a long, long time. So I'm feeling this scar tissue release right down to my left wrist. Yeah, we're all, if you haven't figured it out, we're all connected. Yes, we are. There we go. Good. Good. And you can do that in your jaw, if you've had jaw surgery. God forbid, I hope you haven't, but even if you haven't had any external scars, they've done it through the mouth. You've probably had a bone there that was broken, and the fascia will be the same. So up, down, back and forth, rotate, rotate. Just look for tension through the ease and then wait for it to unwind. Yeah. And so lastly, so say you broke your leg, same thing, you can do the fascia up, down, rotate, up, down, right, left, rotate, rotate. The other one, we did it in a I don't know if you can see me here, so go over here. I did it in a video a long, long time ago in a Bliss class. It's called the interosseous membrane, which is the pump between your tibia bone and your fibula bone. We have 4 of them. One in this leg, one in this leg, one in this arm, one in this arm. I treat those on just about every patient that walks in my office, just because they are always tight, even for those of us that have not had any fractures. But especially if you're a runner, or if you're an avid walker, or if you're an active person, or if you're inactive. Many of the swelling of the leg problems is because that interosseous membrane is not working properly. Also, varicose veins. I got some nasty ones here because this is the leg that I broke back in '79. So that varicose vein is telling me that this leg has been under stress for a long time in the way that the blood is getting to the leg and the way the blood's coming back. The vein has expanded because it's trying to get the fluids out of the area. So I broke it in '79. I've never got involved in osteopathy since 2006. So there was a long time there. So what you're going to do is you're going to scoop the tissue, kind of scoop up in behind your leg, and you're going to do this, like a scoop and a separate, a scoop and a separate, a scoop and a separate. And you're going to work down through your leg. Now, if you're lucky enough to have a friend that will do this for you, it's a lot easier. And it's very difficult. You need 2 arms, so you can't do it on your arm. So if you're lucky enough to have a friend that can do this for you, if you're a patient of mine, I will do this for you. If you go to another osteopath, make sure that you ask them to do your interosseous membranes. If you're someone who's struggling with varicose veins, you say, well, they did that. I love to think that one-shot deal would be enough. Often, with treatments that we do, one-shot deal is enough. But if you've had a fracture, or if you've had a foot that's misaligned, or if you've got a bunion because you're now walking oddly or differently, yeah, you need, or if you've had a fracture, or God forbid if you've got plates in there, oh gosh, there we go, that feels better, and I can feel that leg start to have a little bit more energy. Now, yeah, so you need to have that done over and over and over and over and over again, yeah. So, rock tape. Rock tape is an amazing tool to use if you're struggling with a little bit of swelling, or if you're struggling with pain in that lower leg, or varicose vein that's giving you pain. For me, I have broken this foot twice, and I fractured the tibia fibia. So you'll often see me with this leg taped because it's starting to bother me. And like last night, I noticed it, so I know I needed to treat it because I was in bed and I could feel almost like restless leg syndrome. It was just kind of shaking, and it was talking to me. So you can tape it. So this, there's my doorbell, sorry. We have this for sale at the clinic at cost. I basically sell it at cost because I'm not looking to make any profit for it. I just want to get it in. You can order it from Amazon as well. So rock tape, I don't recommend K-tape, just not as good. So you pick what you want to get. So you're going to take this is the pre-cut that you now can buy. You just tear it off. You can also buy stuff that you need to cut. So you tear off an end and you anchor it. I'm going to do my calf because that's what feels the tightest on me. So I'm going to anchor it. I'm going to press it in there good. I'm going to keep my toe flexed. And as I come up my calf, I'm going to put some stretch on the tape. Now, the cool thing of the tape does come with some directions on how to do different body parts. Things like the shoulder, it's difficult to do yourself, but your knee, your foot, your calf, my wrist I can do myself. And there it is. It just sits on there for a while. I can leave that on for a week to 10 days. I can shower with it. I can bathe with it, no problem. It just gets wet, but then it dries. What it's doing is it's lifting the skin, which is lifting the fascia underneath, which eventually will go, that's the superficial fascia, that'll eventually go down to the deep fascia, and it's going to do exactly what we did with these fascial gliding and that scar work. And then it's doing that 24/7 basically, so it's really helping you drain. It lifts the skin, lifts the fascia, lets everything decompress, lets everything drain, lets everything just go, oh, thank you. All right, so that's my little blurb on scars and fascial gliding. Hope this is helpful. Do this as often as you want. As you can tell, I do it quite often, but I obviously need to do a little bit more what I found out from this. So thank you for allowing me to have that discovery. Hope it helps. Any questions, please ask. Take care. Have a great day.